Welcome. Welcome, my dear friends. I welcome you all. Myself, Professor Dr. Deshpande, would like to start this lecture immediately for you. Very interesting lecture. Welcome once again. Myself, Professor Dr. Deshpande, would like to welcome you in this audio video session regarding the convergence. Convergence. Huh? So we will talk today about one of the important complaint from the patient. Either relatives bring the patient that this child is convulsing or my grandfather is convulsing, father is convulsing, and the doctor get confused. This is little bit common complaint, and the most important point, we have to search for the cause of convergence. I know that most common causes are epilepsy and febrile convulsions. That are the two most important causes of convulsions. But as a doctor, you must know the little bit details about this convulsion problem. So I am MD in Ayurvedic medicine, Kaya Chikitsa, and MD in Ayurvedic physiology, that is Kriya Sharir. This is my personal website. Let us make the screen bigger for better understanding. Yes, the screen is big and it's very good for looking to the screen. My mobile, and this is also the WhatsApp number 922-6810630. This is my mail ID, professordeshpande@gmail.com. So if anybody is interested to contact me for online consultations, then to send their palms and understand the palmistry or get the palmistry prediction, that I also do. I take the private tuitions of the students for any topic of any subject. So you can contact me definitely. Let us have a very breaking news. On the WhatsApp group, I have formed two groups. One is English Hindi group, especially English group, and another is Marathi speaking students. So I request all the students from Maharashtra, they can write their name, college name, year, and they can join, they can register free of charge, free of cost on this particular group. I, I am going to teach them free of cost, but as per my time permits, for English group, I may start the Chikitsa subject, and in the Marathi group, I will start the Nidan subject. So they will be sent the links, or they will be sent some tips on the WhatsApp group, but mostly they will also send, I will also send them the proper links on the YouTube where they go and where they listen carefully, make the notes and ask me the difficulties. That's for sharing of the knowledge and experience, that I have formed two groups, two WhatsApp groups. So I request the students from all over India to join in the English group. The students from Maharashtra or whoever they want to understand in Marathi, they can join the Marathi group. So you have to write down the name, address, college name, and which group you want to join. Let us move further. Whether you practice allopathy, homeopathy, naturopathy, Ayurveda, every pathy is good. Every pathy is good. Every pathy has some plus points and some limitations that everybody of us must understand. So, I am stressing this point that whatsoever sympathy is the best practice. Sympathy towards the patient is the best practice. What is the general rule for anybody? That you must try to find out the root cause of problem. I will try to make cursor over there, root cause. And this is called as a differential diagnosis in modern medicine. And in Ayurveda, the word is Vyadhi Vyavacheda Nidana. Write down, for example, I am giving you example. For example, write down the Vyadhi Vyavachedaka Nidan of the cause and describe Raj Yakshma in detail. This is in general, okay? This is example. Another important thing for any pathy, the basic management principle is Ayurveda has very nicely mentioned Sankhepataha Kriyayogo Nidana Parivarjanam. Here in English, here in Sanskrit or Devanagari script. In short, management principle is try to avoid or try to remove or try to treat the causative factors first. Don't try always only symptomatic, only symptom. Of course, symptomatic treatment is necessary for giving instant relief. That I agree. But after that, you must try to find out the root cause and then manage the patient. We are studying medical urgencies in nervous system. I have already talked about vertigo. Video is uploaded. I have already talked about symptom. Video is uploaded. Yes, I have not talked about anaphylactic shock, but in between I have made the remarks. Injection neurobion, injection penicillin, injection imperon, iron injection for anemia. These type of injections you must give to the patient after sensitivity test, after test dose. Otherwise, you will be in trouble because this is called as a prick anaphylactic shock. These drugs are very sensitive for some people, and these people may die on table. So for some injections, you must give test dose. But convulsions, today we are discussing epilepsy. Yes, the video will come. My dear friends, my viewers, my subscribers, I am very thankful for them because they are not only from Ayurveda, they are from allopathy, homeopathy, naturopathy, pharmacy, and physiotherapy as well. So all these people, they love me, they keep the faith on me. But for these people, I will say, go to my, what you can say, the YouTube channel. How you can go? You have to write down Rajendra space Deshpande in the search engine for the YouTube. And then you will get my photo and some playlist. You have to go with playlist. My dear students, my dear teachers, my dear doctors, please go with the help of playlist because there are many 550 plus videos. How you can find the videos? So playlist will definitely help you. Convulsions causes in the adults. Number one, intoxication, uremia. Whenever there is a kidney problem, because urea is a waste product of protein metabolism. Okay, first there is ammonia is created, but that ammonia cannot be excreted. You understand? Then it is converted to the product like urea, which is water soluble, and urea in, that is urine. So whenever there is a kidney failure and that waste product urea is in the blood, that is called as uremia. Amia is a blood. Don't forget, amia is a blood, uremia, and that can cause convulsions. Arsenic and lead poisoning. Some patients, unfortunately, or I don't know, by chance, by accident, taking some medicines which are not standard quality. Especially the blame is always given that Ayurvedic rasaushadhi can cause hepatotoxicity, renal toxicity. This statement is false. Why? Because you must see which company product you have brought. You must go to that company, Baidyanath company, Ayurveda Shah company, see its whole pharmacy visit, how carefully, how genuinely they are making the products by Shuddhi Prakriya, purification of metals, converting metals, raw materials into the nano form, Bhasma. They cannot cause toxicity. No. But yes, if the company is very latest, they are neglecting these factors, that medicines may cause arsenic or lead poison. Arsenic, manashid. Manashid. Yellow arsenic, red or arsenic. Okay. Snake bite. That also can cause the convulsions. Of course, I know by the history you can definitely understand from where this convulsions is coming. Cerebral tumor. That's why I have mentioned. Don't treat convulsions patient every time symptomatically. Every time symptomatically. No, you may not be knowing if you don't do the what you can say the MRI. How you can know about cerebral tumor? There may not be headache, little headache, maybe neglected and convulsions. So don't make a mischief with the patient. Okay, intracranial infections. Meningitis is very common in the children. Meningitis, inflammation of the brain coverings, that is meninges. Very easy to diagnose. two or three two or three things you must note for meningitis. I am talking about meningitis in children. Projectile vomiting. Projectile vomiting. That vomit comes for a long distance. Vomiting. Projectile. Neck rigidity. Neck rigidity. If you want to bend the child's head, it cannot be touched over here. Chin cannot be touched on the GP sternum. That is neck rigidity. And another, plantar reflex. This is my palm. I know. But imagine that this is plantar region. And then if you are moving your clinical hammer blunt end from down to upwards, plantar region, feet, then your toes should be like this. This is normal. But in Babinski's sign, the fingers, they become fan out, fanning of the fingers. Important sign for meningitis. Okay, encephalitis, similar signs. Cerebral abscess, cerebral malaria also. Okay, hypoglycemia, very important. If any patient, if any relative, if any friend has a diabetes, he must aware that this is a silent killer. So he must check the blood sugar now and then with the glucometer. Glucometer should be with the patient always if it is affordable. And whenever the patient complains, a lot of sweating, lot profuse sweating, like your clothes are drenched, wet. The conditions are only two. Number one, heart attack, and number two, hypoglycemia. Never forget, profuse sweating, heart attack, hypoglycemia. In the hyper and hypoglycemia is more dangerous because this is fatal. Patient can die. If the blood sugar goes down, 100, 90, 70, 60, 50, 40 milligram per cent, 40, patient can die. Then another cause, heat stroke for the convulsions. We are talking about convulsions. But the most common causes in the children, febrile convulsions, when the fever is very high, temperature with the thermometer more than 101, more than 102, 103 degrees Fahrenheit, there may be convulsions. Epilepsy, very common cause. Ask the history always. Traumatic, birth trauma immediately after the delivery, forceps delivery, there may be birth trauma. ICH, intracranial hemorrhage, is common in uncontrolled hypertensive patient. Always ask the history of diabetes and hypertension in each patient coming to you after 30 years. Ask him, are you taking? Of course, I know how the conversion patients can answer. You have to ask to the relatives and the family members whether the bring papers first, treat and then start immediate actions. Okay. I think intracranial causes that we have discussed: meningitis, encephalitis, brain abscess, mastoiditis. Mastoid here, behind the ear, here. This is mastoid bone. Mastoid. When there is otitis media, infection in the middle ear, that infection goes here in the mastoid bone and mastoiditis that can cause the convulsions, going infection to the cerebrum. Tetanus dhanurvat that can also cause the, as the history of any cuts, abrasions, wounds, road accidents, as this is convulsions, maybe tetanus. Okay, next cerebrum. This is frontal lobe. Can you see? Huh? Then central sulcus, primary somatosensory cortex. Just you must know where this problem is. Occipital lobe, temporal lobe. Here auditory centers are there. This is cerebellum and this is spinal cord. Okay. Convulsions causes in the children, extracranial causes. Enteric fever, typhoid, cerebral malaria, electrolyte imbalance, most important, loose motions, vomiting, very common in the children. Then sodium potassium imbalance, and that can cause the convulsions. So if the history of loose motions, vomiting, gastroenteritis, cholera, immediately do electrolytes investigation, blood electrolyte study. Ask to the laboratory, send the blood. Okay, hypoglycemia, pyridoxine, thiamine, B1 deficiency, B6. This is B6. This is B1 deficiency. And sometimes, unfortunately, we cannot detect the exact cause of convulsion. Management of active convulsions. I know symptomatic treatment is must. Put the spatula, printing mistake, I will correct it. I will correct it. I don't want to make permanent over there. Okay, so let us make the correction. Okay, let us make, my dear friends, please keep the patience. Please keep the patience with me. Why not it is going here? I don't know. I don't know. I can't understand why it is not moving. Anyway, okay, I can delete. I will try. I'm trying to delete, but it is not getting. Okay, forget. We will not waste our time. I will do it afterwards. But put spatula like a wooden stick, or the wooden ruler covered with handkerchief between the teeth here to prevent to prevent tongue bite. To prevent tongue bite, this is very important. Injection compose which contains diazepam 2 cc intravenous very slowly. Repeat after 15 minutes or SOS as per the necessary. If not controlled, give injection Gardinal. This is trade name. And what is the generic name? Phenobar. There are printing mistakes. I am sorry. Phenobarbital 2 to 4 ml intramuscular. Management of active convulsions. If patient is known, very cautious, listen carefully. If patient is known epileptic, please don't give any injections. Please don't give Gardinal, don't give, because the epileptic fits are most probably automatically controlled, automatically stops. They don't need any treatment. After convulsions are controlled, if the patient is non-epileptic, no necessary for any investigations. That means epilepsy is clear reason for convulsion. Why to waste the money in investigations? Management of active convulsions. But if the patient is not known case of epilepsy, he is not epileptic patient, new convulsions in the middle age or later after 30, 40, 50, do the electroencephalogram graphical record and CT scan. If history of injury, road accident, CT scan and X-ray skull, AP and lateral view is necessary. If convulsions with fever, I forget to tell you about meningitis. Fever is the most predominant. In meningitis, high fever, projectile vomiting, neck rigidity, and Babinski sign, plantar reflex positive. I repeat, meningitis is very common. My dear students, meningitis, high fever, projectile vomiting, neck rigidity, and plantar or Babinski's reflex is positive. Clear? Yes. Lumbar puncture sometimes is needed to confirm the rule out. RO means rule out meningitis. But if the patient is not known case of epilepsy, convulsions in pregnancy especially or postpartum period after delivery, check the blood pressure and urine albumin. Two things are important in pregnant lady: blood pressure checking and urine for albumin, because to rule out toxemia of pregnancy. Very important disease in pregnancy. Don't miss this diagnosis. Preeclampsia and eclampsia. These are the names for that particular conditions. This is not end. Please wait. This is not end. I will go further. I will go further. I will try to go further. Okay. I will try to go further. Not end. No end. I think I will go back. I will check it out. If it is really end the topic, then there is no problem. Yes, I think epilepsy we will discuss in the next time, because I don't want to extend all your these things. Uh, but here only I would like to add, if I am correct, that in the case of convergence, uh, I will discuss more in detail about when I will discuss the epilepsy. But Ayurvedic type of the treatment can also be done. Can you allow me to search whether I have further any reference? I have, because made that PPT. I don't remember where exactly it has gone. I have a lot of PPTs. I don't remember where it is actually gone, because I have made it. What I can do with Ayurveda. But if it is not, I will discuss verbally. No, I'm sorry. Uh, I may tell you that for the convergence, for this type of convergent problems, uh, I don't feel that too many things can be done with the Ayurveda. Of course, if you are expert, you have seen, then Ayurveda has already mentioned about the convergence problems. You can give the two type of treatment, Vegavastha and Avegavastha. Vegavastha means during the convergence. So we have to regain the senses. So pradhamanasya can be done, or simply you can try, if possible, if the patient is not totally unconscious, you can try to put the vacha oil, or you can try for trasana chikitsa, like sprinkling of the water, something like that, to just arouse the patient from that convergence, or to make the stable, because convergence is nothing but the excessive chalaguna of vata dosha. Excessive chalaguna of the vata dosha. So vatagna chikitsa or vata shamak chikitsa can be done, but that I am going to discuss at the time of epilepsy. So please see my further video of epilepsy. I will tell how to do the avegavastha and vegavastha. Vegavastha is a relapse, and avegavastha is, what is that avegavastha? That is the remission. When the patient has no problem in between two epileptic fits, which type of the management should be done, that we will discuss during the topic of epilepsy. But I think here it is enough that you have understood what are the different causes of convulsions, what is the symptomatic treatment of convulsions by modern medicine, because that is most probably important treatment. And then with this, I will like to take your leave. So end of the topic. Always remember, when we talk about any disease in a longer term, then ahar, vihar and aushadhi. Okay. Diet advice, lifestyle advice, which is based on the prakriti, sarata, dhatu sarata, as well as per the disease. And lastly, you can go for the treatment part, that may be shodhana chikitsa or shamana chikitsa, detoxification treatment or the palliative treatment. That's all for today. But whenever I mention any treatment in any video, maybe previously uploaded, now uploading, and future uploading, patients are requested, please don't get treatment for yourself. You visit to the nearby Vaidya, nearby family physician, nearby doctor, or my hona, Dr. Deshpande, and under the supervision, under the prescription of any doctor, you must take any medicine. Self-medication is strictly avoided. I request all the people, okay, all the patient. So, but if anybody make a mischief, his soul will be responsible for any bad consequences. Self-medication should not be done. So I am very thankful to you for patience hearing. I request all of you to circulate my videos, audios with your friends and be a health ambassador and request all your friends to subscribe my YouTube channel. Thank you very much. Wish you all the best. I wish you happy, healthy and long life. Bye bye. Take care. Bye bye. Bye bye.